retransplantation. About 3% in all transplantation in the world are retransplantation, and then about 5% of pediatric transplantation are retransplantation in the world, but the number is very few, and then there is almost none the possibility retransplantation. And then, so duration between initial transplant and retransplantation is described here. And mostly after 10 years or 5 years, the retransplantation may be required. And then the cost for retransplantation is the CAV, and this means the coronary artery vasculopathy, and the chronic rejection, chronic phase rejection is the issue for the issue for requiring retransplantation in most cases. And these are the reason for transplantation in Japan, and then I didn't they translate these all over the world, but I just want to say there's no transplantation, no retransplantation performed so far. And then for coronary artery vasculopathy, so the retransplantation is performed, and then but the cardiac graft function is preserved. It is until the graft function deteriorated, the medication is okay, and the same outcome compared to the coronary bypass surgery. But once graft function is decreased, the result is so different. So probably the key is the preserve the maintain graft function. So the key is the 2/3 of patients are retransplanted within 1 year from the coronary vasculopathy diagnosis. So transplantation in Japan is very few, so that is why it is almost impossible. And then from here, what we can do in a society of here, retransplantation is difficult. Oh, this is the slide. How heart failure outlook is progress, and then sometimes it get better, and then sometimes plateau, and then sometimes like this. So it is so difficult to predict their prognosis by the moment. So recovery from the state of the severely ill state to nearly normal, state close to healthy, is the heart transplant or mechanical surgery support that. So this makes the difficulty in determining the sign of end of life and lack of preparation. So here, that's why advanced care planning in post-transplant is very important. You may hear the word and the advanced care planning. Advanced care planning is a process that assists patients in communicating and understanding the value, the goals and the hopes for future treatment, irrespective of their age or the stage of their disease. So the retransplantation is very different in Japan, so advanced care planning would be very much important in some cases. So there are a lot of things, but the advanced care planning is these three categories, and but the communication when just after the transplantation would be very important. So the conversation to share your life perspectives and values with your family is most important. So writing down and then so in detail is not at all important, and then so this is only helpful. So communication is the most important. And then this is the case, and then the non-ischemic heart disease, and then the renal failure, and then the patient will not be independent anymore, relying on his wife, and the ejection fraction 35%, creatinine 2.8%. For such case, what we can do, and then so the occurrence of complications for fixed prognosis and is unfavorable, and the such type the situation where survival is difficult without regional transplantation, that situation can occur. So setting treatment goals based on the individual outlook of life is very important. Sorry. Okay, so for ACP, advanced care planning, there are 3 stages: the explanation, and then setting treatment goals and consultation treatment options, and then preparation, and then so the explanation of the disease causes, and then the proposal of the proposed patient, how the prognosis is, that is the first stage, and then the previous case. So we explained to the patient you had transplant, and then you had corn transplant, the allograft gastroscopy, and the heart failure, and now you have renal failure. That's the explanation we made. In the second stage, based on the first stage, then we can set a goal, and then just to extend the survival or withdrawal, or just withhold. That is 3 stages, and then the stage 2, and then the patient selected withhold. And then also they said, the patient said, I won't want to have a dialysis, or I don't want to do the ICU treatment. And then finally the stage 3, we said the treatment options. And then, so what each treatment does, and then that type of thing we explain. And then, so for that, the previous patient, we just say, let's continue the current treatment, but we don't do any more, and then we don't do any ICU treatment. That is the explanation. This is the type of advanced care planning. So advanced care planning is post-transplantation, as they describe here, and then heart transplantation is wonderful medical procedure that can give new rest of life to the critical patient, and a post-transplant outcome is very good. However, it should never be the case that the most meaningful treatment for the patient is neglected. And truly meaningful heart transplant care respect your patient's values of life. And then medical team should aware of the patient life in the values. And then in worsening situation, these should be guide care. And then it is important to mention the risk of sudden death in the inpatient with coronary artery vasculopathy. And the third case what we did, we just reviewed the previous case I showed as a case 3, and that is 51-year-old male and 34 years post-transplant and coronary allograft vasculopathy is very advanced stage and linear dysfunction, admission for heart failure. This is actually the patient now I'm taking care in Japan, and he is very active, but his prognosis is poor. So I know he may not be alive probably next year. He cannot be, they spend this Christmas. So what we should do? But even though at the time of advanced care planning, we discussed 3-stage protocol, but the patient and their family, they said he wants to do anything to extend even 1 day survival. So we decided to do the everolimus induction, and then also the PCI is not planned. We don't know because the coronary allograft vasculopathy is very much severe, but he wanted to have the invasive care. And then, so decreased renal function. So he now, they hope to have a living-related donor kidney transplantation. Now his wife decided to be a donor. And then, so margin tumor and the PTLDs, we had the through body screening. And then, so employment. So he was a teacher, but now we know he cannot continue that work. And then so we know the coordinators is now involved in the meeting. And then it's advanced care planning for her. So and then as a summary, I want to present one more case. And then so waiting retransplantation for 16 years, and then the patient actually started the development. And patient was 20-year-old, and then he was diagnosed as dilated cardiomyopathy, and then required heart failure, the heart transplantation. At the age of 23, he had heart transplantation abroad in the US, UCLA, and then after returning to Japan, and then he carried out the activities to the broadcast and the message transplant the situation. And then the age of 27, he was invited to the national committee, and then he gave a presentation about his case. And then in the same year, thanks to his presentation, and the organ transplant law was established in Japan. And then, but he developed transplant corneal artery vasculopathy and repeated several procedures. And at the age of 35 years old, and after 20 years post-transplant, he required retransplantation status. So, we put him on the waiting list because his heart did not last long, I think. And then he again developed, he actually developed PTLD, that is kind of the malignancy and readmission, and then some surgical treatment he received, and then his coronary artery vascularity progressed, and then at the age of 46, his life after transplant became longer than life before transplantation. And then he developed right heart failure, ascites, renal dysfunction. He's getting severely ill. But even then, so we put CRTV in the defibrillator implantation because he may develop sudden death. But he is still very actively broadcasting on a transplant all over in Japan. And he was on TV, in America. But at the age of 51, he died while waiting for transplantation. And then it was 20 years post-transplant. Sorry, it was 12 years. Not 12. Sorry, how many years? 27 years post-transplant and 16 years post on the waiting list. That is the case. What happened in Japan? Okay, so this is a summary slide, and then despite fewer organ donation in Japan compared to the Western countries, the concerning overseas transplant and pre-transplant, pre-overall establishment and patient, and then there is rising trend in patient in the 10 or 15 years the chronic phase, and then. So the Japan actually has a very excellent post-transplant outcome, and the medical profession like me, our role to the support transplantation in leading the happy second life. So that is the key message. So the perhaps the key is the advanced care planning. So probably in India, transplant is not in this area in Chandigarh, so probably transplantation is not possible sometimes. So advanced care planning, how to inform patients and how to take care of their life values would be the key to take care of patients. Oh, thank you.